Okay, it sounds like we have Athea Bracy on the panel.
Huh? Ooh, yeah, that'd be great. Thank you. Okay.
We
And
also have
freckles,
a question for Michelle Smith Whittam. Asks, can you explain the fourth nerve palsy?
fourth nerve palsy.
Mm-hmm. PALSY.
Let me look at this. Phyllis says, "Can I get a list of your products?" If you click on my picture in the upper left, that'll take you to my bio. There's a link there that'll take you to the website, which has all of the eye care products on the website. I didn't know a way to say that without saying the word that shall never be spoken.
I know, right?
It's crazy.
Who's that?
Coco.
This one's good.
All right. All right. Excellent.
I love you.
So
Freckles, why are you looking that up? Freckles 054 asks, my eyes are red when driving at night.
you've gotta add moisture back into the eye system. You've got a serious issue with moisture in the eyes. Your eyes are red from driving at night because they are dry all day long, and then at night they're like, I've had it, I need a break. So that's where you're getting all the redness and the irritation. You got to add moisture back into the eye system, and I'm sure you're driving with the AC on more than likely, or with the heat on at this time of the year, and that forced air into the eyes is actually drying it out even more. So add moisture, add moisture, add moisture, add moisture, add moisture. And if you want a really good quality moisturizing eye drop, Revitalize is the drop for you. Hey, Darren Hooten says, I hope you're doing fantastic. I'm doing just fine. I'm so glad to hear from you. Yay, I'm so glad you're doing well.
So Five Right asks, do you recommend an injection in the eye for swelling in the back of the eyes?
I don't suggest the injections unless you've tried everything else and there is no other choice. So that is a last resort. So fourth nerve palsy, fourth nerve palsy, also called trochlear nerve palsy, is an eye movement disorder that happens when the fourth cranial nerve, the trochlear nerve, is weak or damaged. This nerve controls the superior oblique muscle, which helps move the eye downward and inward. Here's what it means in simple terms. The trochlear nerve is one of the smallest cranial nerves, but it has a big job. It keeps your eyes aligned and allows smooth coordination movement, especially when you look down, like when reading or walking downstairs. And when this nerve is affected, the superior oblique muscle can't move the eye properly. As a result, one eye may drift slightly upward. The eyes don't line up, leading to double vision, diplopia. The double vision often gets worse when looking down or to the side. People often tilt their head to the opposite shoulder to reduce the double image. This is a classic sign of fourth nerve palsy. Interesting. Thank you so much for bringing this subject up. So, it goes into common causes, which doesn't really matter. Recovery and treatment. Some cases, especially those caused by minor injury or diabetes, improve on their own over a few months. Prism glasses can help correct double vision. Eye muscle surgery may be useful if symptoms don't resolve after 6 to 12 months. Managing underlying causes like blood pressure and blood sugar is important. So in this situation, what I would do, I would absolutely want to lean on castor oil and DMSO to make sure that you're handling any kind of inflammation that's occurring in and around the nerve. However, you've got to positively affect the nerve to get it repairing in some way. I would use the C-Clear with DMSO without a doubt. And there's a piece of me that I would use the 4-in-I too, because that's reparative and restorative in the eye. And when you're talking about nerves, you really don't have a way to measure what's going to work. So you got to try multiple things, multiple different ways until you get the kind of traction that you want to have in the eye system with that nerve, that specific nerve, and then do the necessary exercises and training with the eye to get that muscle structure and the nerve structure operating, properly.